Okay, can you hear me now?
Yes, I can hear
Okay,
you.
great. So thanks so much for getting on the call. Like I said, I think we'll have a couple more people jumping in, but since you're new to the call, I wanted to give you special thanks. Now you're down at Jersey Shore, is that correct?
No, JFK.
JFK. Okay, great. Um, and so I think, and you're emergency medicine, correct?
Yes, yeah.
Okay, great. I think that really sets you up well for participation in the course. I've had co-course directors in the past who were emergency medicine physicians, and um, it's just you have such a breadth of knowledge. It's really nice, and it's also applicable for the students. So
Okay,
I think you'll
good.
enjoy it. Um, so this is a going to be a lot of new information for you, but um, for our previous year's faculty, excuse me, there'll be a bit of review. So I'll go slow at first, and then when we have more people jumping on, I'll probably speed up a little bit. So
Okay,
this course is called Structural Principles, what your role is going to be. Let's see if I can get
okay,
this
sounds
working.
good.
Okay, so the goals of this development session are, first of all, to talk about the location of structural principles within the context of the overall School of Medicine curriculum. We have a 3-year core curriculum, and I'll show you kind of where this fits in so you have an idea of where the students are at this point in time. Um, we'll talk about the overall structure of the lab and how it works on a functional basis and some things that have changed from last year. I'll talk to you about how to best prepare for sessions. And then we'll talk about the logistics, which are often the most daunting thing. Where do you park? How do you get in the building? Those kinds of things. Where do I go once I get here? Okay, and then here's the agenda. It really just mirrors what I just said. Um, where do structural principles fit into the SOM curriculum? What is the lab format and what has changed? How do you prepare and what are the logistics? So we always start off in any of our faculty development sessions with the School of Medicine's vision. Um, each person in New Jersey and in the United States, regardless of race or socioeconomic status, will enjoy the highest levels of wellness in an economically and behaviorally sustainable fashion. And as you'll see, as I touched briefly on one part of our curriculum, the human dimension, we really embrace this vision. I think, I've been at a number of medical schools where the vision or the is kind of something that is on the wall that you pass by every day and you don't really pay any attention to. But I think we're very intentional here about making sure that the curriculum matches this vision. And obviously, the students need to learn things like anatomy and biochemistry and clinical medicine, and it won't always tie in explicitly into this vision, but we always try to keep it in mind when we're thinking about what we're teaching. So here I'll give you a brief overview of structural principles in the School of Medicine curriculum, and where it fits in, and where the students are at this point in time. Okay, so here's our overall School of Medicine curriculum. I don't know, are you able to see no, you probably can't see the arrow, can you?
Yes, I can.
Great, okay. So as you can see, we have 4 years, but we have a 3-year core curriculum, 1, 2, 3 years of core curriculum um, that is made up of 2 phases. And the first phase is called the Sciences, Skills, and Reasoning phase. The second phase is our clerkships, and that takes us to the end of the 3rd year. And then our 3rd year is the individualized phase. Um, what would traditionally be kind of your first 2 years of medical school, your basic science year and your clinical science year, take place in phase 1. And so we compress those 24 months into about 16 months. And we typically have 2 courses running simultaneously. We have a longitudinal course that actually runs all 3 years of the medical school called the Human Dimension. And in that course, students are paired up with another student, and those pairs of students are paired up with a number of families within the community, and they follow those families longitudinally. They don't provide medical care. They help to shepherd them in some ways through the medical system, but really the goal there is to help our students understand what things look like from the perspective of a patient. And they're embedded within communities in the area. We have been really fortunate to have strong relationships with a lot of our community organizations in the area, so they can really help find the families that best instruct the students about the principles that we'd like them to see. At the same time, the students are in phase one in one of what we call a sciences, skills, and reasoning courses, and I'll get back to that in a second. Those are more of what you would think of as our traditional courses. Phase two, like I said, human dimension continues in kind of a slightly diminished fashion, and they move into their clerkships. And our clerkships, we have a transitional clerkship, and then a number of relatively traditional clerkships, with the exception of a longitudinal emergency medicine clerkship. And we don't take step one until after the clerkships. Then they move on to some advanced clinical rotations and step two. And let me see if I can move this. And then in phase three, this is our individualized phase. Students have the option of doing a number of different things. Some students will actually, after 3 years, go directly into residency in the HMH system, and we've set up all the infrastructure for that. Other students will do dual degree certificates, focused community, global health, clinical research experiences, and like I said, some will enter into residency. That's really for those students who have excelled academically and are ready to take that step. Okay, any questions so far?
No questions.
Okay, just feel free, like at any time, to just if you have a question, just speak up.
Okay.
So there's phase one, like I said, and let's kind of focus in on that. Phase one is 16 months, and there's the human dimension course up above, and then each of those sciences, skills, and reasoning courses. And we start with 2 foundational courses, molecular and cellular principles. The students are right there. These barred lines are the summative assessment blocks. So they have a large exam, an OSCE exam, and then they do some other kinds of testing. So they're getting ready to take those exams, and they're, as you would expect, a little stressed out about that. And then the next course, structural principles, is the course that you'll be involved in. And this is a course that includes anatomy, principles of anatomy, histology, basic pathologic principles, and medical imaging, in addition to some pharmacology. So it's a real mix of different topics. And then after that, we move into a number of systems courses that combine the basic and the clinical science within each of these different systems.
Okay.
So here's our course, structural principles. And just to give you kind of an example of what a week looks like. So we try and frame each of our weeks using cases. And so every Monday, and it may not be the first thing the students see Monday, the students will have a large group case introduction related to the topics within the week. And it really is meant to bring together all of those different topics. And then at the end of the week, they get together in small groups and do a number of activities, bringing in the topics throughout the week. And these are facilitated group sessions. Throughout the week, a variety of different activities, teaching in a variety of different ways. So in orange is a pedagogy, a teaching style called team-based learning, where students are required to do work in advance, come in, they're held accountable through quizzes, and then they go through some problem-solving exercises. In purple, these are labs. So these labs are a little bit different than traditional gross anatomy labs. So I think somebody's trying to call in. Let me see what's going on here. Sorry about that.
Okay.
Okay. And on Wednesdays,
Michael Sabara.
Oh, there we go.
Is now joining.
Hi, Michael.
Hi, sorry I'm late.
No
Got
problem.
stuck.
I just got a message that there are some participants on a generic line. Let me send them to sign in real quick.
Okay,
Sorry.
no problem.
So you guys called in on the conference ID, if you remember, it ended in 653.
I can check. Yes.
Yes, it did, 653.
Okay, let me just send them that.
Okay.
7307. ID 295 67 653. Okay. Okay. So, Michael, I was just going through the structure of the curriculum and the weeks, which I think you're already pretty familiar with. So there's not too much catching up for you. But in yellow, you'll see some of our human dimension activities. In addition to going out in the community, the students also have large group sessions. One thing that you're not seeing here, it's down kind of below the line. In structural principles, we tie in the physical exam with the regional anatomy that the students are learning. So in this week on abdominal structure, they'll do the abdominal exam, and it's not the only time that they'll see it, but it's the first time. So here are the labs, and right now we have about 96 students. So with that number of students, in order to maintain a relatively small teacher to student ratio, we split the students into two groups. And when group A is in lab, group B is in a large group session, then they do a flip-flop, then group B comes down to lab, and then group A takes that large group session. And we do that for all of our labs. What that does mean is you don't have any student that dissects the entire region for the day, but the students are responsible for kind of handing off that material, and I'll talk about that briefly. Okay. So how can you learn the abdomen in a week? The answer is you cannot learn the abdomen.
Michael Rose
is now joining.
Good morning. So, if this is our abdomen week in structural principles, it's really impossible to learn all the material. But what I want you to remember is this is just the first pass, and I'll talk about this again. If we go through down to our nutrition, metabolism, and digestion course, there will be multiple either labs or large group sessions where our plan is to build, and we've done this already for the first run of the course, to build upon the material that the students see in this first week of the course in subsequent courses. So there's a lot of communication that goes on between, me as the director of structural principles and our director of our homeostasis course, which includes it includes cardiac, pulmonary, and renal, to talk about what the students have seen already and what's coming up. Okay. So where are the students in their education? And this is a really important point. Not very far. So these students are in their 4th month of medical school. The vast majority of them have had no prior experience with anatomy. So they're learning the language. And, as you can remember from taking anatomy, this is drinking from the fire hose, right? There's a million concepts and just names coming at you. And so that's just something to keep in mind. We are really asking a lot of them here, not only to just memorize things, but to understand the content of this course in the context of the histology, the radiology, the pathologic principles. So what we want you to do is continually think about who you're teaching to. You're teaching to the level of a first-year medical student. They're very good first-year medical students, and they're going to ask you a lot of really good questions. But remember, they will have chances to see this again. So no need to train them to be a hand surgeon at this point. We will be very explicit in terms of what we expect them to know, and we'll make sure that you know that so that you are helping them learn at the appropriate level. And I'll go through a little bit about how we're going to do that. Okay, so let's talk a little bit about the laboratory format and some changes for 2019. So all labs will be dissection sessions. Last year, we had some labs where students rotated through a series of stations. And this was useful, but with the increasing number of students, it increases the burden on our faculty. So all of the labs will be dissection sessions, and I'll go through the format of this. we have the labs go for 4 hours, and they're split into two 2-hour sessions, and as I explained before, Group A and Group B. The teams include 7 to 8 students, and you will only see half of them in there at a time. And Group A will do the first 2 hours, half of the time. Half of the time, Group B will do the first 2 hours. But in occasions where Group A does the first 2 hours, they will finish up, and then Group B will come into the lab, so they'll both be in there. Group A will conduct a verbal handoff to Group B. And so we're actually patterning this after a clinical handoff. In order for Group A to know what Group B did after they left, they're going to have to come in after class, and that's part of their responsibility. So just to kind of diagram it out, we have 3 or 4 students of Group A who will dissect for about a little less than 2 hours. They'll do a handoff. Then the 3 students from Group B will dissect again for about 2 hours. And then be a debrief for Group A that has to happen outside of class. Okay, so here's a change for 2019. Last year, we were not really that strict about the distribution of faculty in the lab. And what we found is that sometimes an area would have 4 faculty covering 4 tables, and then you'd have a half of the lab with just 1 faculty member. And so we're going to try and be a little bit more directed about where faculty should be covering in the lab. And I'll talk about what you're actually going to be doing there in a minute. So we will have 12 tables. They're not going to be set out exactly like this, but we also wanted to make sure that students had both clinical faculty because of what you contribute, as well as the core anatomy faculty because of our contribution and our knowledge of the course content. So if you take these 12 tables, and again, this is just a schematic, it's not going to represent exactly how things are going to work in the lab as far as the diagram goes, but you'll get the idea. Faculty will be assigned to color-coded regions of the lab. You will stay with those tables throughout the lab. So if you are assigned to these 4 tables, that is where you're going to stay. Okay, so they'll have, I don't know if these will be the colors, but let's say we have a green region, we have a blue section, and we have a pink section. Your job, if you are in that day and you're assigned to the green region, is as the clinician, you're to stick to these tables. Fortunately, we have enough clinical faculty and enough core anatomy faculty that we can also have one of our anatomy faculty in that same area. So our goal, and we may have a few days where we have to modify this, is to have each region covered by both a clinical faculty member and a School of Medicine anatomist. Okay, and we'll give you a little name tag that has a colored star on it or a colored circle so you know exactly where you're supposed to be.
So Keith, that would be Anthony and Michelle, correct?
Yes, correct. I'll introduce them at the end. Anthony Pagano and Michelle Tatunuk, who are the other 2 core anatomists at the School of Medicine. Okay, so one of the other changes is really helping you understand what your goals are in lab. And I think, again, last year, we threw you in there without giving you what I view as enough orientation to what your specific role was, and you did a great job. I think, one of the things the students came out of the course with was just an excitement for working with clinical faculty, and because this really is the first chance that they're getting to work with clinical faculty on a one-on-one or a one on several small number of students basis. And I don't want to lose that at all. But at the same time, I want to make sure that you're coming in there knowing exactly what the expectations are from us in terms of what knowledge we want you to be covering. So we will be giving you more explicit instruction about structures and relationships that we would like the students to know. We're going to have lists of structures that we will provide, and I'll give you a little in a second a way that we'd like you to approach any of the encounters that you have with the students. So we've given you this list of structures and anatomical relationships, and the 3 things that we'd like you to focus on in an encounter with students are structure identification, structural relationships, and clinical significance. And like I said, I'll go through an example, but as a little kind of easy way to remember this, and we'll put this on your name tags as well. ID, structural identification. Around me, structural relationships. And why? What's the clinical significance of these structures? Okay, so whenever you walk up to a table and you can't remember, what am I supposed to do with these guys? Think ID, around me, why? At the same time, we want you to, as needed, be providing assistance in dissection to students. And then, really what the students got last year and was really amazing for them is this clinical flavor that you can provide. The stories talking about, how this structure was so important in a procedure that you were performing, or how variation, was an important factor when you were doing something. Whatever comes to your mind, that's perfectly fine. But again, we want our priority to be here on that ID, around me, why, and then this dissection assistance to students and clinical flavor. And the reality is you can kind of throw these in all at the same time as you get used to doing things in the lab. Let's go through a quick example of this ID, around me, why. So first week of labs, students are going to be performing a laminectomy, and they've done this amazing exposure of the spinal cord. And we've given you in advance a list of spinal cord structures for identification. These include the conus medullaris, the filum terminale, the cauda equina, the meningeal layers, the denticulate ligaments, and the dorsal root ganglia. So again, you walk up and you think, ID, around me, why? You're walking up to the table and you notice they've exposed the meninges, they've exposed the conus medullaris, the cauda equina, and filum terminale. So first thing is ID. And I like to walk up and say, hey, how you doing? Show me what you got, really. Just asking them to identify what they have and what are some of the things they've been having trouble with, okay? Always give them the first shot. I think it's very easy to jump in there and say, oh, you have a beautiful spinal cord. Here I see the cauda equina, and here's the filum terminale, and the dorsal and ventral roots, and all the layers of the dura. But they've already taken the time to dissect and to identify these structures. So put it on them. Put it on them to really let you know what these things are. And if they get it wrong, that's okay, right? This is a learning environment. We're not there to make them struggle, but it is okay to give them the first shot at identifying structures. And then around me, what are the important anatomical relationships in here? So think about questions for the students. And this is some thinking you might want to do in advance once you know those structures. We'll give you some of these, but a million anatomical relationships of relevance. So we might ask them, what are these denticulate ligaments and where do they derive from? What about this filum terminale? Which of the meningeal layers is it? At what layer does the spinal cord end? It looks like this stuff keeps on going down, but where is the actual end to the spinal cord proper? Okay, so that's all around me relationships. And then the why. And again, here you're going to be using some of your clinical experience. You might ask them, what's the clinical significance of the spinal cord ending at L1, L2? Why doesn't it go, if it went further down, what might,
Unknown
what
participant is now joining.
If it continued going down, what constraints might that enact on our ability to, get cerebrospinal fluid? Whatever you'd like to throw in there. And some of our resources will have good examples of clinical significance. Okay, so ID, around me, why? And for those of you who joined a little bit late, I'm recording this as well, so I'll be sending out the recording. And we also have another one coming up. I'm sorry you had some trouble on the phones. Okay, so that's the first change for 2018. Really, or the second, I guess. The first is really the reorganization of how we're going to be distributing ourselves in the lab, and then this focus on ID, around me, and why. The third change is the integration of radiology. So this is something that we really did not do that well last year. And what we're finding is that our students are now coming into the systems-based courses, not understanding the basics of even looking at a CT scan. I'm not really too worried that they can, do in-depth interpretation, but I want them to be able to walk up to a chest X-ray and have an idea of how to orient themselves to it. They're getting that in later courses, but what we really want is in this course for them to get a strong foundation in that. So the way we've decided to integrate radiology is work with radiologists. At the end of each week, so each Thursday lab, we're going to have 2 radiologists coming into the lab. And they will pull 1 to 2 students from each group for about 20 minutes at a time. So you'll never have a group that's empty, right? We want students to continue to do their dissection. And they'll pull them to the end of the room. And they will have very explicit goals in their discussion with the students. In those 20 minutes, they're going to be talking about the basics of imaging techniques, not really focusing too much on the idea, the physics of X-ray or CT scan or MRI, but really the practical aspects about these imaging techniques. They are going to reinforce the anatomical content from the week. And then they'll present a short problem-solving case related to the modality and the content just discussed. So going back to this example of the first week where we're focusing on the back, this would be a really nice time for them to see a X-ray of the lumbar region. And they can start to think about the idea of different areas of radiodensity. They can think about relating what they're seeing to bony anatomy. And then we can work through a case as well, okay? And those will be a little bit more prescriptive than the kind of teaching that you'll be doing in the lab. Time permitting, they actually may circulate through the lab to assist. So, don't be surprised if you see them at your tables as well. Okay, so that's kind of the changes and the overall lab structure. Were there any questions that anybody had?
No.
Okay, so
No.
pre-work and preparation. Preparing for lab sessions. We want to make sure that you come in as prepared as possible. And so we will do a few things in order to help you prepare. And if somebody, if I'm hearing some feedback, so if you can mute, that would be great. So first, we're going to ask you to prepare by reviewing the learning objectives. The learning objectives are really the crucial things that we want our students to know. Okay, they'll say things like, describe the structure of the intrinsic muscles of the back, something like that. In addition, we'll be giving you a structure list. These are the specific structures and some relationships that we want our students to know. These are the guideposts. The students are required to do pre-work. And so as far as the pre-work, we have a few different types of pre-work. If somebody could please mute, thanks so much. So our student pre-work will include a custom dissector. We had a dissector last year and we'll be adjusting it again. We're including this year pre-work videos that are voiceover PowerPoints that really go through a framework of what the students need to know, and actual dissection videos. So these are videos that will show the students in advance what they are going to need to do. So it really should hopefully speed up that process for the students of getting in there. What we've seen in the past, and I've seen this at multiple schools, is students get into lab and they say, okay, what are we doing today? We really don't have the time for them to figure that out. We really want them to know in advance, okay, we are conducting a laminectomy today, and these are the steps. Everyone's reviewed it. Okay, let's go. And we will provide links to these materials and a little bit of information in a faculty guide that we will send you about 2 weeks prior to the session, 1.5 to 2 weeks prior to the session. We found that if we send it too far in advance, it kind of gets lost. If we send it too soon before the session, then you don't have time to prepare. So 1.5 to 2 weeks seems to be a good number in general. So before the session, you're going to review those materials, and I'm going to ask you to think about those questions related to ID, around me, why. Okay, the ID shouldn't be too tough. The around me, a little bit tougher. And the why, this is where you can really use your experience to ask them or talk to them about the clinical significance of these structures that they're learning about. We would estimate about 2 hours of preparation before the session, depending upon how comfortable you are with the material. This is crucial. We ask our students to prepare. They're probably preparing for 4 hours before the session. You may take less time, as I said, depending on how comfortable you are with it, but think about it like a surgery. You're not going to go into a surgery without reviewing the patient records, looking at the imaging, and thinking about the approach you're going to take. So try and do the same thing here. It's really going to make you more comfortable in the lab, and it's going to make the student experience better as well. Okay, any questions on preparation before labs?
Are you going to be sending out a list of clinical correlations that you might want us to associate with each structure, or is it just free?
Yeah, we'll send a pretty basic list, and it probably won't be for every structure. So there is some, you do have some latitude, but we will give you a little bit of guidance there.
Okay.
Okay, any other questions on the pre-work? Okay, logistics, the most important thing, getting a hold of things and parking. So accessing resources. For many of our resources, I'll say you need to access the library and our course learning management system in order to view some of these resources. I'm going to try and make it as easy as possible for you to get a hold of these. The problem is no matter where you are in the health system, there is some sort of file sharing program that you do not have access to. So Dropbox works in some places, but not in others. SharePoint works in some places, but not in others. So we'll do our best to make sure, and I'll take your feedback as we go along to see if you're actually able to get a hold of these resources. The easiest way to do this is to make sure that as a faculty member, you should have something called a Seton Hall campus-wide ID. This is basically your ID number, and that gets you your email and your library access. Okay, so everything should be accessible through the library. And if you do not have a campus-wide ID, or you don't know what your campus-wide ID is, you can do two different things. If you never received it, you can email the Office of Faculty, and they should be able to help you. If you have one, but you don't remember your username and password, which is quite possible, you can call SHU IT support at this number, 973-275-2222. They're actually very helpful and should be able to get you your username and password reset pretty quickly. Okay, so this is the time to do that if you don't know what those are offhand. They actually make you reset them every 60 days. So if you had one and you haven't reset it, then you're probably going to have to call them anyways. Okay, parking. So they've really cracked down on parking on campus. You must have a valid parking permit. If you do not, or if you're in a lot that you're not supposed to be in, or in a space you're not supposed to be in, you will get a ticket. I actually walked out the other day and I saw in the student lot, there were rows of students parked illegally and they all had tickets. So they have really cracked down. And the last thing I would like to see is for one of you to get ticketed for volunteering your time here. There are two options for parking permits. So if you are one of those faculty members, I think Michael, you probably have this situation. You're on campus a lot, so you can actually get a permanent sticker or a placard. If this is what you want to do,
Yes.
you can just provide the name of your primary hospital to me, and then I will pass it along to the Office of Faculty, and they will work on getting you a permanent sticker. If you just are going to be here once or twice a year and you don't really want to go through the trouble of the paperwork, we will send you a day pass prior to your session. So all faculty, regardless of whether you have a placard or you don't, will get a day pass prior to your session. And I'll be sending these out probably within the next week or so. You need to print this out and you need to place it on your dashboard. Again, if it's not printed out and placed on your dashboard, you'll get it. Okay, so where can I park? So just to orient you real quick, if you've been to the School of Medicine before, well, either way, this is the main street along in front of the School of Medicine, Kingsland Street. And then here's Route 3. Okay. This is east to the right and west to the left. Our main entrance has traditionally been right at this point between Metro Boulevard and Kingsland Street. They're doing a whole bunch of construction on this building right here. So there are some road closures. So in order to get to the lots that you're able to park in, you need to go down Kingsland Street, depending on which way you're coming from, and you're going to come to Ideation Way. You're going to, and you'll see immediately some spaces that there are no meters, there are no signs. These are kind of some secret parking places that if you get here before 7:20 or so, 7:30, you should be able to catch one of these. It gives you a little bit less of a walk. This is where I parked this morning. Okay, so you'll see these. You'll see some along Medicine Way, and then there are gates that go into the student parking lot. We cannot park in there. Everybody who's at the School of Medicine is not allowed to park in there. Only the students. So if all of these are full, this would be kind of my first recommendation. If all of these are full, keep on driving down Ideation Way. You're going to pass under this bridge between the School of Medicine and the Center for Discovery and Innovation. Looks kind of this triangular building. You'll pass by the water coolers, come to a dead end here. You'll make a right, and the first left you can make, you'll make that down a little hill, and now you're in what we call Lot 3. Okay, because it's pretty much by Route 3. It's kind of far away. So it's about a 5 or 10 minute walk back to the School of Medicine. It's parked down here. It's going to be closest to getting to the School of Medicine. There are a number of numbered spots down here. Make sure not to park in those. Those are actually reserved spots. And then you're going to walk back down Metro Boulevard, around to the front door of the School of Medicine. If you have a Seton Hall ID for the School of Medicine, you can actually go to the back door and get in that way. If you don't, you'll have to come around to the front. Okay, that may be changing as security goes over to HMH, but for the time being, you'll have to walk around to the front. So point is, I would say you need to give yourself a good 15 minutes from here to find a parking space, find your way around, and then walk to the front. If you have an HMH ID card, that should get you into the building. Should not be a problem. All you need to do is show it to the security guard. They may actually ask you to sign in, but they should let you in. You should all have my cell phone number, and I'll make sure you have Laura's. And we will also enter you into the Envoy system, which basically says who is coming in each day. But you should not have a problem. You're going to go to the second floor, and you're going to head east. If you came up the main stairway, that means you're going to make a left. If you came up the elevators, depends which elevators you came up. Once you head down that hallway, you're going to pass by the blue-colored wings on the left and on the right, and you'll go through a double set of double doors. You'll immediately see a bank of lockers. They're mixed blues and whites, and you can make a left, and there'll be a changing room that's for use by faculty only. There should be somebody hanging out around there, either our lab manager, Laura Roundtree, or one of the faculty who will be able to let you into the lab. So when to arrive? Like I said, make sure to allow 10 to 15 minutes from when you park to get up to the anatomy lab. Please arrive by 7:30 for the lab. We do a pre-lab session from 7:30 to 8. So we let you know, here is your area, here is the anatomist who you're going to be working with. We go over, here are the goals, here's what the students did last time, so you know where they are, and we'll give you a little bit of time to speak with the School of Medicine anatomist in your area to familiarize yourself with what's going to be happening. The lab session will run from 8 to noon, and as I said, there's a short break in the middle. At the end, if you're able to, we'd love it if you could stick around for a short debrief. It's not mandatory, but we would truly appreciate it. Just for 10 or 15 minutes, so we can get your feedback on how the lab went, things that need to be reinforced, things that were a bit of overkill, things that you said, why are they really learning this? And that's really good feedback for us. A few lab rules. No food or drink in the lab, so please leave your coffee outside. You can wear what you're comfortable in. A lot of people wear scrubs, but we also have people who come in their work clothes and will just wear a lab coat, and that's fine as well. We do have clean lab coats for you and any type of personal protection, personal protective equipment that you need in case you don't wear scrubs, or even if you want to wear on top of the scrubs. We have gloves, plastic aprons, booties. If there's anything that you need besides kind of standard PPE, please let us know, and it shouldn't be a problem for us to get a hold of it. Okay. Before I get there, any other questions on parking protocols?
Keith, Mike Kelly here. You know, I'm not there every day, but I'm there quite a bit. Would I qualify for a permanent one?
Yeah,
Between
absolutely.
the monthly things and interviews and everything else?
Yeah, so if you do something like if you're come to monthly meetings, or if you do student if you're on admissions, absolutely. So Mike, I will actually pass your name along to the Office of Faculty, and
Okay, thank you.
so that's
Yeah.
the process, right? Mike said, hey, I want a placard. I know he's at HUMC. It's that easy. Okay, a few additional points. So our Director of Institutional and Curricular Design, Beth Colts, she's going to be working with us in the lab this year, providing formative feedback regarding teaching strategies during sessions. So you may see her following behind you, kind of looking over your shoulder, listening to you, and after you do one of your ID around me, why type of activities, she might pull you over and say, hey, I think you did a really good job here. You can do a little bit of improvement there. When you're doing a clinical correlation, maybe try and do this. What we found is that giving this just-in-time feedback, and again, it's really there just to improve your experience and the experience for the students, that it can be a really valuable activity. So please expect that. Just one other thing to expect: we have 2 students this year with physical disabilities. We have one who has visual and auditory impairment, and one who uses a wheelchair. And so we've worked extensively with both of them, and we've been working with the Seton Hall Disability Services office just to make sure that they will be able to participate in the lab. We have various ways that we will be accommodating them, and are not anticipating any issues, but we felt that it was just the responsible thing to do, just to make you aware that these 2 students will be in the lab. They're both great, and I think they will provide a perspective, and they already do provide a perspective to our other students about the potential for different types of individuals to succeed regardless of one's disabilities. So it's great having both of them. Okay, I think the final thing, 2 things: additional lab personnel. So I mentioned Anthony and Michelle. Anthony Pagano and Michelle Titunik are our other School of Medicine anatomists. Laura Roundtree, she's our anatomical lab manager. If you need anything about scrubs or jackets or gloves or anything like that, if there's a formaldehyde spill, if a patient or if a student looks like they're about to pass out, Laura's the one to go to, right? She really runs the ship. And so she can help you with anything that you need. We're there as well. We know where everything is, but she knows where everything is. Okay. And here's my information. If you need to get hold of me, email is generally best, but if it's off hours, you can try me on my cell phone as well. Office phone is probably the worst place to get me. I'm generally not here. Okay, so I'm going to end there and open it up to any questions that you might have. Okay, so I don't know that we have any questions. Let's see who we had on. Okay, well, I wanted to thank you for joining. Like I said, this is being recorded, so I will put the recording, I'll give you a link to the recording. And if any questions come up in the meantime, please let me know, and be looking out for that lab guide as well as your parking permit a week or 2 before the session. Okay, thanks so much.
Thanks, Keith.
Thank
Take
you.
care.
Multiple people are now exiting.